Welcome to our discussion about menopause with a particular focus on early menopause and bone health. I'm Heather Currie. I'm a gynaecologist based in Dumfries. I'm a trustee and past chair of the British Menopause Society and founder and MD of Menopause Matters. I'm going to hand over to Sarah to introduce herself.
Hello, I'm Sarah Leyland. I'm an osteoporosis specialist nurse and I work with the Royal Osteoporosis Society as a clinical advisor.
Thank you. And the purpose of this discussion is just to raise awareness about the link between menopause, about the effect on bone health, and particularly what to look out for when approaching menopause, what symptoms to look out for, what we can do about it, and with the particular focus on what we can do to look after our bones. Sarah.
Thanks, Heather. Right, let's start with a very straightforward question. Perhaps you could explain to us what is early menopause, maybe how common it is, and what are the signs and symptoms?
So early menopause is when our menopause occurs before the age of 45. And if it occurs before the age of 40, which is believed to happen in about 1% of women, it is known as premature ovarian insufficiency. The average age of menopause, which is when our periods stop because we become low in estrogen, is 51. So the earliest signs that things are changing is all related to the function of our ovaries. So to have our normal monthly cycle, which involves the development of eggs, the release of egg, which could be fertilized in some cases, and the production of hormones, which are having effects all over our body, but in particular having a thickening effect on the lining of the womb, which then is shed in the absence of pregnancy. For all that to happen, we need to have well-functioning ovaries with plenty of good quality eggs. Sadly, we have a finite number of eggs. So in our sort of 40s, going into our 50s, usually our egg supply changes both in number and in quality. And so the hormone cycle is no longer possible. The hormones are not produced. The lining of the womb isn't stimulated, and hence periods stop. So period stopping is the sign of the natural menopause. But in a few years before the final period, which, as I said, the average age that happens is at 51, there can be a change in the cycle, a change in the period pattern, and that might be the first sign that things are just going a bit wonky. Gradually, as our ovaries produce less estrogen, then there are various symptoms related to that. And there's a huge variation in both the type of symptom, the duration of symptoms, the severity, and most importantly, on the impact on each individual woman. Flushes and sweats are the commonest sign of gradually becoming low in estrogen, but also there can be mood changes. So low mood, irritability, anxiety, brain fog, difficulty coping, and also joint aches. And these, the mood and the joint ache symptoms, are often not known to be associated with, not recognized to be associated with hormonal changes. So often women may have a mixture of symptoms for some time before they actually associate that with a change in the function of the ovaries and hence a lowering of estrogen. The same symptoms can happen if the menopause happens at a younger age. It's just often even less expected then, because young women associate menopause and hormonal changes with much older age, and they're often not prepared and don't link the symptoms with a hormonal basis.
So that can happen naturally, Heather, but presumably there are other things that can cause an early menopause. Maybe you could explain a bit about that.
Yes, so many women who have an early menopause, we don't actually know a cause, so often tests are undertaken to see if there is an underlying cause. In many, there is a family history. So often women will give the story of, oh, my mum had her periods in her 30s, stopped her periods in her 30s or early 40s. But we do investigate in the younger women. Surgery is an obvious cause. So if the ovaries are removed for whatever reason, maybe at the time of a hysterectomy, removal of the womb, then that's a sudden menopause. So periods are going to stop anyway because of the hysterectomy. But if the ovaries are removed at the same time, there's a sudden drop in the production of estrogen, and so a sudden onset menopause. And often women that experience a surgical menopause have quite severe symptoms, which can start quite quickly, even quite soon after the operation, because their bodies have been used to a higher level of estrogen, and then suddenly it's withdrawn. And sometimes these symptoms, as I mentioned, can be quite severe. There are also certain medications which can affect the ovaries. So, for example, medications that we can use often in gynecology to switch off the ovaries for various reasons, but that would be a temporary menopause, and we would hope the ovaries would return to function again when the medication is stopped. But some women that require chemotherapy or radiotherapy, depending on the types, these also can have a significant effect on the ovaries, so that an early menopause can be caused by treatments such as those.
And are there tests that you would need to have to confirm that you were going through an early menopause?
We do usually do tests if women appear to have menopause under the age of 40. It is a really important diagnosis to make. It often has a devastating effect on women, particularly young women who haven't yet completed their family. And so we look for underlying correctable causes. We would look, for example, at thyroid function. We would look at prolactin, because sometimes high prolactin can affect the function of the ovaries. And in very young women, we'd also test for chromosomes, because there are some chromosomal linked conditions that can affect the ovaries as well. In the measuring hormone levels is carried out, although we do know that hormone levels can fluctuate significantly. They are worthwhile in the younger women, but if, for example, someone over 45 has what appears to be menopausal symptoms and a change in the period pattern, there would be no need to do hormone tests in these women. We would make the diagnosis based on their symptoms and their period pattern at the time.
And you talked a bit about the effect on women when they have an early menopause. Could you just describe that a bit more, you know, these sort of emotional effects and so on that they might have to go through?
Yeah, there's a lot to take in, especially if someone hasn't completed the family or haven't started the family, and suddenly they're told that they won't be able to have a family because their egg quality isn't good enough or their egg numbers are very low. And sometimes their only hope of a pregnancy is by using egg donation. Even in women who have had a family, it still can be quite devastating that the choice is taken away. So it's quite different to choose to take contraception, not to become pregnant, but to have that choice, that option taken away can be very, very difficult. It's also, you know, we often associate, even women going through the menopause at the normal age, often associate menopause with older age. And none of us feel as old as we really are in our heads. We can be quite different. So it is very difficult. There's a lot of support often required. And when we come to talk about treatments, again, that can have quite a big impact. So we will, as we'll come on to say, hormone replacement therapy is really helpful for various reasons in young women, and often is recommended. But for someone to take HRT, they sometimes think, well, that's what my granny takes. It doesn't feel right that I'm taking that. So we often have to adjust that with different types of hormonal therapy, bearing in mind the psychological impact as well as the physical symptoms.
That's really helpful. And Heather, tell us a bit more about the long-term health effects of having an early menopause. Perhaps I don't think everybody knows about this.
Having an early menopause does increase the risk to the bones. So bone health is hugely important. We build up our peak bone in our early years. Estrogen is really important for our bones. So within the bones, there are different battles going on between different cell groups. So there are osteoblasts, which are bone builders, which are making good, healthy bone. And there are osteoclasts, which are bone munchers, which are munching away bone. And usually there's quite a fine balance between the two so that bone remains healthy. With the lack of estrogen, the osteoclasts, the bone munchers, live longer. And so they have a predominant effect, and that can lead to the bone thinning, osteoporosis. So with estrogen having such a crucial role on bone, kind of makes sense to understand that the earlier that we lose the estrogen, the more time we have with the lack of estrogen having a detrimental effect on the bone. After menopause at any age, we know that bone health is affected, and we have lots of advice to give to women, lots of information that we want them to know to be able to keep their bones as healthy as possible. But the effect of estrogen has the biggest effect when it happens early, when the loss of estrogen is earlier than usual.
And I'm going to talk a little bit more about osteoporosis in a moment, but maybe before I do, you could just describe, Heather, some of the other long-term health effects of that loss of estrogen.
So the other system in our body that's affected by the loss of estrogen is the cardiovascular system, so the heart system. So we know that young women who have an untreated early menopause do have an increased risk of cardiovascular disease, heart disease, because like estrogen is very good for the bones, estrogen's also good for our circulation, for our heart function, and again, the earlier at which someone loses the estrogen, the bigger there is a risk later on. There is also some evidence that estrogen affects brain function. And again, having an earlier menopause seems to lead to an increased risk of dementia at a later stage. So I guess a key thing to remember is that estrogen has effects throughout the body. And so with the lack of estrogen, how our body responds to that does vary, but it can have wide-ranging effects.
That's really useful. And then going back to osteoporosis, which is obviously my particular interest, I thought I'd just explain a little bit more and remind people about what osteoporosis is. So this is a condition where bones lose their strength, they become weaker, and they break more easily. And it's these fractures or broken bones, sometimes called fragility fractures, that cause the pain, the disability, sometimes the change in body shape, loss of height, curvature of the spine. So the quality of life effects are very much the fracture. And as Heather's really nicely described, it's because of this lower level of estrogen, and particularly this early loss of estrogen, that we see this increased risk of osteoporosis in women. And maybe, Heather, perhaps we could go on now to talk a little bit more about hormone replacement therapy for someone who's had an early menopause. You mentioned its importance, but perhaps you could discuss it a little bit more, and also perhaps how long you need to take it and how people can be making that decision about whether they need HRT or not.
Yeah, so for women who have an early menopause, it is now recommended that unless they have an absolute reason not to take HRT, so for example, hormone-dependent cancer, then it is recommended that they are offered hormone therapy and that they take it at least until the average age of the menopause. And this is regardless of whether they have some of the symptoms that we described earlier. Women going through menopause at normal age, their choice as to whether they take HRT or not is related to the symptoms that they're having and whether or not the symptoms are having an impact on them. But for the younger women, because we feel it's so important about these long-term effects on the heart, the cardiovascular system and bone health, that it is worthwhile recommending treatment even if they're not having symptoms. The majority will have symptoms, so they will have benefit from this control of symptoms. And the reason we advise taking it until the average age of the menopause is because then their bones in particular are not losing out from these extra years without estrogen. When we say hormone therapy, for many people that is hormone replacement therapy. So we've talked about these effects being due to the lack of estrogen, and the purpose of hormone replacement therapy is to replace the estrogen. If the womb is still present, that's also combined with another hormone, progestogen, which simply prevents estrogen stimulating too much the lining of the womb and causing a thickening, which eventually could become unhealthy. If the womb has been removed, and for example, we did talk about some women having an early menopause due to surgery, due to hysterectomy, and perhaps removal of ovaries at the same time, in that case, estrogen alone can be taken. But as I've mentioned a little bit earlier, there is a big psychological impact on young women taking HRT, and for some women the combined contraceptive pill is a more appropriate option and is in line with what her friends are taking. And even though young women were talking about early menopause, some women may still need contraception. So especially in the women where we don't have a definite cause, it is possible that sometimes the ovaries can kind of waken up and release an egg at a later stage. So if a young woman with early menopause doesn't want a chance of pregnancy, you have to be aware that HRT isn't contraceptive, and sometimes it's more appropriate to offer hormonal therapy as part of the contraceptive pill, which also is replacing estrogen, albeit in a different way, but provides contraception at the same time.
Right. Okay, that's really helpful. And perhaps I could just go on to mention a little for those who also have osteoporosis, that when you stop HRT, that's going to perhaps be the time to think about whether you are at risk of fractures and whether it might be appropriate for you to have some other sort of drug treatment for osteoporosis. And we do have a range of other treatments bisphosphonates, other drugs which you can discuss with your doctor, with your healthcare professional. So as Heather said, it's HRT usually up to the age of the menopause, and then reconsidering whether to continue with HRT, whether you need to for your bones, or whether there might be another option that's more appropriate for you. So I thought I'd have a brief mention of those other drugs. Perhaps we could go back, Heather, just then to talk a bit about bone density scanning, which is a way of measuring and understanding the strength of our bones. Many people feel that that's what they need in terms of understanding whether they've got osteoporosis or whether they need further treatment. It's not quite that straightforward, I know, and I wanted to ask, how do you work with bone density scanning in your practice? Do you need a bone density scan if you're going through an early menopause? Be useful to hear your thoughts.
So there are some recently published new recommendations that's suggesting that it is worthwhile if there's already some bone thinning, and bearing in mind for some women it takes a number of years before early menopause is diagnosed. We hear stories of women who've had a mixture of symptoms that hasn't been connected as being hormonal, and in this time, if they've had lowering levels of estrogen, then potentially there could have been an effect on the bones. In our own practice, and I'm sure many others, depending on resources, capacity of your DEXA scanning service, then we haven't carried out DEXA scans in this situation, but it is something that we are going to have to relook at and consider to see if there are a group of people that it's worth understanding that if they're already at a level of reduced bone density, then would that affect the management? In these young women, the recommended treatment would still be hormone therapy, but there may be some women who you'd need to keep a little bit of a closer eye on, and that has come out in a recent international recommendation.
So I think what the priority is, what you're saying, is that they're taking HRT sort of preventative, really, to try and that's a general need, and that it doesn't always mean you need to have a scan before you start the treatment. I think that's what I'm understanding. It's a pragmatic approach that seems to work really well. Yeah, so that's helpful. Okay, shall we go on to talk a bit about bone health and what people can do and the positive changes that they can make at this time? Maybe I'll start off, and people do often ask, women ask, what lifestyle changes do they need? What do they need to think about at this time of change? Really, it's a broad picture of healthy living, and the great news is that it fits with trying to prevent cancer and trying to prevent heart disease. So the recommendation is really to eat well, to eat a very well balanced, mixed, varied diet with adequate amounts of protein and adequate amounts of calcium. So we need to be getting around 700 milligrams of calcium a day, but it is that broad-based approach. We need to be thinking about other healthy options like reducing smoking if we are smoking, and not having excessive amounts of alcohol. And then we need to make sure we're getting adequate amounts of vitamin D, and that's what we get from exposure to sunlight during the summer months. But now we're moving into autumn and winter. The recommendation is to think about whether you're getting a little bit of extra on top of that, and the recommendation is to get around 10 micrograms of vitamin D, and it's quite hard to do that from our diet, so considering taking a supplement is the other option, and that's very much recommended as something to consider during the winter months, and particularly if you're someone who doesn't get out during the summer months because you're covering up, or certainly through the pandemic, we've all been reducing the amount of time we go out, and so that's an important aspect too. Anything else you'd like to say around that, Heather? And then I'll perhaps talk a bit more about exercise, which is a particular interest of mine.
No, I think that's really important, actually. And when we see when women ask for help related to menopause, whether it's early menopause or whether it's average age of menopause, then what we'd really like is that women understand that the effects of becoming low in estrogen, the initial changing signs are the periods changing, the flushes, the sweats, the mood changes, but actually let's see it as a wake-up call. Let's see it as a way of thinking, okay, my body's changing now. This is how it's affecting me now, but what's going to happen in the future? What can I do now to invest in my health later on? And I think over the years, there has been much more awareness of the symptoms, and that they may go on a little bit longer than we originally thought they would. And therefore, treatments may be needed more than just a few years, but it's very individualized. But also, maybe we haven't focused enough on the lack of estrogen affects other systems in our body. And all the dietary changes and lifestyle that you've just talked about can, in some women, help reduce the symptoms. Actually, the flushes and sweats can be reduced by reducing alcohol and caffeine and smoking, which is great. And exercise, you're going to mention, is hugely important, but it's also helpful for our heart later on, which that's the risk on that is changing too. So it's trying to see the onset of symptoms as a trigger to not only think about what we need to do to get through that stage and to control our symptoms and carrying on doing all the things we do, which is many things, but also to think later and to think investment in our later health.
No, I think I totally agree with you there, Heather. And I think as what we often say is it's not just a time of change, but it's a time of opportunity, really. And so, as you say, considering all these things, and to talk a little bit more about exercise, as you say, I mean, it's interesting that exercise may help with symptoms, and we know it helps with well-being and heart health and so on. But we also know that exercise can help to promote bone health. It's not a magic solution. So if you are at high risk of fracture, we can't say it's as good as taking a treatment, but it's certainly complements. And we've done some interesting work recently with experts in the field looking at exactly what type of exercise we need to be doing. And it probably does need to be what we call moderate intensity. So if we want to do the very best for our bones, it's probably around doing a bit of what we call weight bearing, body weight pulling on the skeleton, but with a bit of impact behind that. So a bit of jogging, a bit of low level jumping maybe, and some muscle resistance. So working our muscles quite hard if we can. And if we are well enough and able to go to a gym and really work at that, then that's the best we can do for our bones. So adding that into our aerobic exercise program is great. And for most of us at the menopause, it's a real opportunity to do that, because when we're older and frailer, we may be able to exercise to keep active and fit and to improve our balance and so on, but there isn't quite the opportunity then, or we're not able perhaps to do these more intense types of exercise. So there's a challenge for you. Not everyone can do it, but I think there's something to aim for. So we hope we've given you some ideas there about lifestyle changes and other things you can do to help your bone health. Anything else, Heather, you want to add before we wrap up? I think we've covered quite a bit, and I hope that's been really useful for you, understanding and taking some action to help with bones at the menopause.
Yeah, and just related to exercise, let's make it fun. Dancing's good, isn't it? That's good for us.
Yes, absolutely.
Well,
choose what you like and keep doing it is what we say. Absolutely.
But there are also very effective treatments available. But whatever treatment we choose that's right for us, then let's keep really investing in our health later on with the simple stuff. So thank you, Sarah. I've enjoyed the discussion. I hope Sarah has too, and I hope you all have too. I hope it's helped increase awareness of the importance of menopause, of early menopause, of the link between hormones and bone and other later health conditions. So I hope you've found that useful, and for more resources, they will be available on the what? Sorry, the last bit.
Yeah, no, we've got lots of information at the Royal Osteoporosis Society. We've got printed information, website, and we've also got a specialist nurse-led helpline. And we'll, as Heather said, we'll make sure there's information available with this video for you to find out more.
Thank you very much.